even branched out into the Cedar Falls area just to teach even from middle school all the way up through high school about nursing careers, so that as they're making their choices for what careers they want to choose and what avenues they want to pursue, we want to ensure that they consider the profession of nursing. We also have other allied health careers at Allen College, so we bring them in and we give them some hands-on into each and every career that we offer through Allen College, so they know about those careers, they know about what the educational preparation has to be, they know about how you can become that, what the certification is, how much money those professions make, because our kids really want to know about, when I get done with all of this, how much money am I going to make? So we make sure and tell them. And then we make sure and spell it out, what kind of money, what that kind of money means. What can you do with a salary of $50,000 a year? So we try to break it down so we reach them at their level.
And that's great. And I'm going to detour a little bit. When we think of the field of nursing, we always just think of nurse,
Right.
you know, going in, administrating medication. What other roles? I mean, when you say nurse, what other roles or profession is within that healthcare system?
There are multiple avenues when you talk about being a nurse, and that's one of the great benefits of the profession of nursing. I have had multiple jobs in nursing, and I've loved every single one. I've never gotten bored with my job. I may have left because I wanted a new challenge or a new career path in nursing, but I've been a registered nurse for almost 20 years now, and I love everything about it. And that's what I tell students. As your life changes and becomes, your competing demands are competing for your time, your nursing job can change. You can be a school nurse and work the same schedule as your small children when you need to be home with them. You can be an occupational health nurse and work for a factory or large corporation like John Deere's or Tyson. You can be an office nurse and work in a doctor's office and see patients all day, so you have a pretty 9 to 5 schedule, and you can expect to be home evenings, weekends, and holidays with your family. You can always work in the hospital, and as you know, there are multiple units on the hospital. You can do the ER, you can do the ICU or the intensive care unit, you can do the pediatric unit, you can do the mother-baby where babies are born, you can do recovery room, anything you want to do in the hospital. You can take an RN and do that. And there are many, many more. We have nurses who do utilization review or insurance. Some of them may even work from their home in doing their job, have an office, a home office where they work out of. So nursing is just a wide profession that offers you so many opportunities.
That is great. That is great. Thank you for clarifying that. Now, Doreen, does Allen College have a goal or a motto it is working towards in terms of diversity of students and faculty populations?
We don't really have a model that we're following, but what we've tried to do is set our goals high. We looked at the area that represents the Waterloo geographic area where we are located, and we said we'd really like to have a goal to one day reach the diversity, to have our student body reach the diversity that's represented in the Waterloo area. And so I think right now that Waterloo is about 14% diverse, and so we'd like to one day grow to that. We started the Office of Diversity Services in 2009, and since inception of that office under Dr. Jerome's leadership, we have saw our diversity percentages grow from just under 2% when I started, which was 2005, to almost 7%. Right now we're currently just under 5%. And I could look at that in two ways. I could say, well, we were almost at 7 and now we're at 5. But Allen College is what we like to call a 2+2 school. So you don't do your whole 4 years at Allen College. You go somewhere else and do your undergraduate prerequisite courses. And then you come to Allen to do your straight nursing courses. So most students are at Allen a maximum of about 2.5 years. So we've seen our diversity percentages fall a little bit because we've graduated students. And that's kind of hard to look at as a negative.
Exactly. Now, are the students just from Iowa?
No. Actually, our students come from a large geographic area and many outside of the Iowa area. About 28% of our students come from the local area. So roughly about 1/4, a little more than 1/4 of our students. But our students come from all around Northeast Iowa, all around the state of Iowa, Minnesota, the surrounding states. We even have students as far away from California, Alaska, many,
Awesome.
many different states represented at Allen College.
Great. Now, Doreen, we're going to get into the meat of the program, because I want to say congratulations to you and the staff, but I understand that the college received a nursing workforce diversity grant from Department of Health and Human Services, Health and Resource, and Service Administration.
Yes, we did, and we're very proud of that fact. This is actually a grant that we tried for 2 years,
Okay.
and the second year we were awarded the grant. And I'm very, very personally proud of the grant. My title with the grant is that of project director, and I helped with our grant writer to sit down and write it. And it's something that's very near and dear to my heart, because it was part of my master's research to increase the diversity in nursing, and why don't we see more minorities coming into nursing. And actually, you hit on a little bit of that earlier, is that many times we find in minority communities, students don't have a realistic expectation of what nursing really is.
Right,
They think of the nurse they see in the hospital, but they really don't know what she does. They think of her as just following the orders of the doctors. And nursing is so, so much more. It's an autonomous profession in which nurses really, really play a great role in the healthcare of the patient. And so we wrote a grant to try to teach students more about that and give them realistic expectations and role models. Our hope is to equip students from disadvantaged backgrounds with the motivation, skills, knowledge, and resources to successfully enroll in and graduate from Bachelor's of Science degree in nursing programs. We want them to pass the NCLEX RN, which is the certification exam for a registered nurse after she graduates, and enter into the professional nursing workforce so that they help us to increase the diversity in nursing. We also have as a second goal of that grant to strengthen the cultural competency of the Allen College community of faculty, staff, students, and partners in order to remove any institutional barriers that jeopardize the success of prospective and current disadvantaged and minority students. And what we mean by that is we live in Iowa, a state that's about 96% of the dominant culture or the white culture. And so many times when we see minority students enroll in campuses, they're on predominantly white campus where they may be few in numbers. So oftentimes students can feel socially isolated or alone.
Sure.
And we have to ensure that institutions recognize that and change some of the way in which we do things so that we roll out the red carpet and make students feel welcome and appreciated and show that we really embrace the diversity in which we found. And so that's kind of what we mean when we say remove some of the institutional barriers. Research has deemed that as students feel more connected to a campus environment, their success rates improve and they stay, they are retained and they graduate. So that's what we are trying to do at Allen College. We not only want to recruit students, we want to retain them and graduate them.
And that is so very important. Now, I would like for you to give a shout out to this research team that consisted of assisting you with helping this grant, because when you said 2 years, I can just imagine blood, sweat, and tears and long hours. Who assisted you with this grant?
We actually had two main grant writers, Iowa Health Systems and Allen College employed grant writers, and the first one was Brandy Orr. In the first year she helped us to put it together, and Brandy has moved on to work for the Iowa Health System in another location. And our current grant writer is Mary Kunkel, and Mary just did an awesome, awesome job of putting the grant back together, polishing it up, and making it look good. And due to all of her hard work, we were awarded this grant last year, 2011. And we were only one of 11 colleges across the nation that received this grant, and it is almost $1 million over a 3-year period. So we are quite proud of it, and we do want to say thank you to Mary for all of her hard work.
Kudos, kudos, kudos. That is awesome. Doreen, going to switch gears a little bit. With summer coming up, I understand that you're having some summer camps at Allen College.
We are.
What's going on with that?
As part of our grant, the Nursing Workforce Diversity Grant, this year we're going to do our inaugural nurse camp. And what that is that in our grant, we wrote for this nurse camp because we actually want to take high school students and bring them onto campus to teach them about careers in nursing. Some of the things that we said were missing, that we didn't have realistic understanding or expectation of what a nurse did, we felt like if we brought them to campus, immersed them in the campus atmosphere, let them meet college administration, faculty, staff, and students, all while tailoring a special program to have them become more familiar with nursing, that we could help to at least pique their interest and hopefully their desire to one day be a registered nurse.
That is great. So 9th grade to 12th grade?
9th grade to 12th grade, students in all 4 grades.
Okay.
Or if you're an 8th grader coming into 9th grade,
Yes.
you can apply. If you're
Okay.
a senior getting ready to graduate, you can still apply. We are prioritizing spaces so that we are looking more closely at juniors and seniors.
Okay.
Since they are in a position where they are closer to graduating and making decisions about where they're going to go to college and what their career path is going to be. We are giving them priority admission status if they meet all of the other criteria. But all high school students are encouraged to apply.
Okay. So what is all of that consist of a day at the camp?
Oh, it's going to be a busy day, but we're looking forward to it. In the first, initially, when we are going through and selecting applicants, we will be putting out this Friday application materials at the high schools,
Okay.
at UNIQ for Talent Search and Classic Upward Bound. You'll be able to pick up application materials there.
Okay.
We will prioritize and select. You must first meet the educational or financially disadvantaged criteria
Okay.
that are put out by HRSA,
Okay.
which is our grant funder. After you meet that, we are